At the virtual COMI meeting, there will be a lot of discussion about the role of immunotherapy, particularly T-cell engaging therapy in multiple myeloma, which remains the hot topic of the day. First, of course, was the discovery that CAR T-cell therapy could be highly effective in multiple myeloma with very impressive response rates, up to 100% of patients responding. There are two lead compounds that are moving forward in the clinic, one from BristolMyers Squibb, BB2121, and one from Janssen Pharmaceuticals. Interestingly, the results of BB2121 are maturing. Unfortunately, although initially it looked like many people might be cured by CAR T-cell therapy, time and experience has taught us that, in fact, the average remission duration is only about 1 year if end-stage patients are treated. Nevertheless, this is still sufficiently encouraging that the FDA submission has occurred. Clearly, these companies, particularly BB2121, are moving very rapidly into earlier stages of care, perhaps replacing autologous transplant or using an early relapse. The molecule being explored by Janssen is not far behind. It is now already completing phase 2 and entering phase 3 clinical trials, and early data are similarly encouraging. One thing of note has been the toxicity profile of the drugs in myeloma seems to be a little bit less than it is in lymphoma. Perhaps still quite high frequencies of cytokine release syndrome, but less acute neurologic damage. There has been some suggestion recently that there may be some later neurologic effects, and by later we mean within the first 100 days still, that may resemble a Parkinsonian-like syndrome. CAR-Ts, there are many others being in development from other companies and other nations, but this realization that perhaps people aren't being cured as frequently as we had hoped has led to resurgence in interest in the follow-up molecules, the BiTEs and the bispecific antibodies that target BCMA or other targets. And again, very encouraging response rates with bispecific antibodies, with bispecific or trispecific molecules. Early days, but high response rates. PFS still needs to be learned. And I think the questions people are beginning to address are whether or not these could be used as off-the-shelf products, a little bit less toxic, more convenient, and perhaps can be used in settings like maintenance or post-CAR T-cell therapy. So we're excited to learn at the meeting some updates on where all of these various molecules are at, because this is clearly going to be the future of treatment of this disease.